My talk at the MS Trust conference today was about social determinants of health in MS. And by that, we mean the sort of conditions that people are born in, live in, work in, and get older. So it encompasses the whole of life around the person with MS. So their housing, their employment, their safety, access to transport, and access to medical services. And, you know, there is evidence that different aspects do have an adverse impact on outcomes for people with MS. So it's really about working with the healthcare professionals who are coming to the conference to help them to understand some of these aspects and how we can help better support people with MS. People from different ethnic communities may have a different understanding of MS. And I know that people from the South Asian community often feel quite reluctant to disclose their diagnosis of MS. And I think it's a really important area for us to learn more about. So I'm actually working on a project with colleagues from Queen Mary in London to look at the experience of minoritized populations. So we need to understand this, and that if there are barriers, how again can we help to improve our practice and make sure that delivery of services for people with MS are as inclusive and equitable across all the populations that we work with. So different populations have different stressors in their lives. And you know, one thing about a case history that I talked through at conference today was about a person with MS who, from the point of diagnosis, hadn't attended follow-up, hadn't attended for her MRI imaging, and hadn't attended for her follow-up appointment, and was really lost to services, although she had fairly active MS. And then what we found when we did manage to make contact with her was actually she was living in a hostel. So I think we make assumptions about people, and the risk is that people who don't respond to routine letters, for instance, you know, who may actually not be living in that address, who may have been made homeless, or who may be living in temporary accommodation, can lose the support. And certainly, I think we have to be really aware of that, and also try to reach out to people living in different circumstances. So, for instance, our MS specialist nurse team would go out and see somebody who's living in a hostel setting, or we have a homeless charity next door to our hospital, and we would go out and see people in the setting that they're in. So I think it's again about how do we provide equity of access to healthcare, and appreciate that maybe our rigid systems aren't the best for many people. And actually, you know, when people, we sometimes have this problem with people who are on disease modifying treatments, and the home care companies will say, oh, they're not getting any response and they haven't. It's about how do we do our best to engage again with that person. And I'm just not saying it's easy, you know, but we have to be creative in how we think about where people are in their lives, what stresses they're facing, and how we engage with them. I mean, I think one of the areas we're due to get an advanced MS champion in Leeds, and I'm really keen that person helps us to work with the populations that we aren't engaging with as well in the community, and you know, and who are living in difficult circumstances and are maybe not coming to clinics or not speaking currently to the MS nurses. So I think it's a challenge, but I think it's a challenge I'd quite like our advanced MS champion to take up with us, really. In our seminar today, we talked about the factors in MS that make them more vulnerable to losing their jobs. And there's been research in the area looking at different factors. So obviously, if you have a physical disability and you have a manual job, then it is very difficult in that situation to look at how you adapt in the workplace. But actually, if we help employers understand MS better, and I think there are ways that reasonable adjustments can be made for people in working in different industries. I mean, it's not possible in all situations. I think there is variation in different types of employment, because, as you know, some people may be able to work remotely using their laptop, and and they can fulfill their role at home, and have found, actually, with all the challenges that the COVID pandemic gave us, one of the things it did do is make it more flexible for some people to work that way, and actually that allows people to not have to commute, to pace themselves during the day, so in terms of fatigue, to perhaps eat a more healthy diet, to take a bit of exercise during the day. So that's fantastic. But obviously that doesn't work for all people with MS. So apart from physical impact of MS, there are also cognitive issues and psychological factors. So we're doing a lot of work on the impact on job loss of self-efficacy, and it's very difficult advocating for yourself in the workplace, and I think that's one thing that the MS healthcare professionals can help with, and often people will know that their employers don't really understand MS, so how do we provide information for both the employee who's living with MS but the employer, so that we can explain that actually some of the changes we can make in the workplace are not difficult for the employer and lead them to having a much more productive employee. Yeah, so vocational rehabilitation is planned for people like people with MS who have difficulties either in accessing work or staying in work, or getting back into the workplace. And the format of vocational rehabilitation depends very much on what that person's limitations are. So what is impacting their work setting. And that can vary quite a lot from one person to the next. So I guess in similar ways to general rehabilitation, it's looking at that person's impairment or possible disability, and then looking at what goals they have. So what do they need to change to make themselves successful in their workplace, to make work easier for them? And so it's working together in vocational rehab, either to help them re-enter the workplace, or actually, most importantly, if we can, focus on keeping people in work, because what we don't want to happen is that we hear from people with MS that they've already lost their job. We need to be hearing if people are having difficulties with their job, what can we do as healthcare professionals to support them to stay in work? I think if we think about vocational rehab overall, I think that we don't have great provision in the UK of vocational rehab, although there are some centres of excellence, but we do have excellent occupational therapists who do work on employment and MS. So I think it is, again, it's teamwork really, with the person with MS in the centre, us trying to support them to stay in work by understanding what their needs are and what's having an impact on we call it work instability, the risk of job loss.